Well, is your hair starting to disappear? Our next guest wants to help you get to the root of the problem and help stimulate regrowth. All right, how's that sound? Dr. Lisa Patel with Texas Rich joins us with more on how that can happen. Good morning.
Good morning.
All right. Dr. Patel, I want to start with the fact that you were in a car accident at one point, a pretty bad car accident, and part of your treatment was chiropractic care, and that's what made you decide to go into this because you saw how you got better. Explain to people what chiropractic medicine is.
So basically, chiropractic care is we treat musculoskeletal conditions. Most of us think that it's just spine-based, but head to toe. I'm certified as a sports chiropractor, so I use different therapeutic modalities, muscle work, rehab, exercise, decompression therapy to help treat these musculoskeletal conditions on patients that typically rely on pain management, sometimes have to go through surgery. And so we try to do it as holistically as possible for them.
Yeah. And you say holistically, it's like helping the body to help itself, right?
Heal itself, yep.
Yeah. All right. Hair restoration. So many people deal with this. They try the topical things, the whole bit. They try creative hairstyles, parting it to the side until the side is like way over here, right? But what you all do, and I think that the key is in that word restoration.
So basically, we've the regenerative side of my practice, I've got a nurse practitioner, medical doctor that work with us, and we started to implement hair restoration with the use of PRP, which is basically platelet-rich plasma, and then the more innovative product that's called exosomes to help promote the growth of the hair follicles and then prevent that hair loss. We've gotten pretty good results with, men, women, all ages, with balding, alopecia, receding hairlines, pretty much any kind of hair loss that you see, we would be able to help it.
All right, so with PRP, platelet-rich plasma, explain how that process goes.
So that is basically when we take your own blood. We would take about 10 cc's of blood, and then we put that blood through a centrifuge and spin it down. The top part of that blood is going to be the PRP portion, and we take that out, and then we'll put those into small little syringes and then use that to inject back into the scalp for you.
All right, and then exosomes?
So exosomes are actually the regenerative part. They are going to be derived cells from umbilical cord blood, and we will take those and mix it with the PRP. But the exosomes are going to give you more proteins, more of the growth factors than the PRP will, and it'll give you a longer, much more effective treatment than just PRP.
All right. How many sessions for each one of those things? How many sessions are recommended?
So we start off recommending at least the 3 minimum. Of course, every patient is going to be different depending on how much balding they have, depending on how much area they want to cover. But we start with recommending 3 consecutive treatments, space them out around 4 to 6 weeks to really get good results with it.
Yeah. Okay. So, and it kind of mimics or goes through that typical hair growth cycle?
Hair growth.
Yeah.
Yep, the 4 to 6 week hair growth cycle.
Okay. What does the cost look like?
So every patient's going to be different. And then again, are we doing just PRP? Are we doing exosomes? My nurse would assess every patient to see what their needs are, and then we would base the treatment plan off of that. However, we are offering a 10% discount right now for anybody that is watching this show. So it is a cash-based package deal. So if you'd like to get in on this deal, please call us today.
All right, and we'll give people that information in a minute, but then I have a question for you that's a mystery to all of us. As we get older, why is it that the hair on my head would get thinner, but, chin hairs, no problem? All of a sudden, they come from nowhere.
I think a lot of it has to do with hormones. Again, I think it's all person dependent. Plus, as we get older, our stem cell count starts to decrease. I mean, I could go into a whole side of that, but I think between the hormones and then our stem cell count as we get older starts to decrease is a good combination of both.
All right.
But
we'll
something we don't look forward to dealing with.
Right? Yeah, chin, no problem. But anyway, Dr. Patel, thank you.
Can we just transplant it up there?
Right. Thank you so much.
You're welcome.
All right. Texas Rich has a special offer for Great Day Houston viewers. Contact them today and receive a 10% discount on hair restoration. To receive a free consultation, give them a call at 281-606-0905. 281-606-0905. And for more information, log on to TexasRich2020.com.